Port Hackers, I'm Dio. It's 8 minutes gone past 5 p.m. Conversation does continue right now. Thanks for joining in. We're discussing, well, every matter we discuss is an important one. But you probably heard the saying that health is wealth, and everything that you want to accomplish in life, or have ever hoped to or will hope to in the future, is dependent pretty much largely on the state of your health, because if that were hampered in any way, you're very much unable to perform even the most basic of tasks, let alone something that might change your life or the lives of other persons for that matter. However, as important as health or healthcare delivery, accessibility and delivery is, it poses a major challenge within the Nigerian space. I don't imagine there's anywhere where a perfect system is running, but no doubt there are lots of shortfalls or shortcomings or deficits, if you will, as far as healthcare delivery and accessibility, especially the quality kind in Nigeria. How serious or prevalent is this challenge? What steps are being made by individuals and organizations to bridge the gap? How can you benefit from some of these initiatives? These and other related matters we're discussing in this hour. And joining me in the studio at this time is a pharmacist, Max Obeka. He is President, Christian Pharmacist Fellowship of Nigeria. Pharmacist Obeka, good evening to you. You're welcome to the show, Max.
Thank you, Dio. Thanks for having me.
Let's start with the preamble I gave a while ago, one pretty important thing I mentioned there. Now, you're a pharmacist, and I'm not exactly certain how it works in your industry, in terms of hierarchy and all of that. But and I speak as an outsider right now, one may not consider pharmacists to be very much in the thick of things, maybe as thick as doctors, for example. Because if I go to a hospital, for example, I'm not looking to see a pharmacist, I'm looking to see a doctor. Now, based on the doctor's prescription, I may then be referred to a pharmacist who is going to dispense this medication to me. In other instances, if I feel a slight headache or fever, I could also visit a pharmacy to speak with a pharmacist. So I believe to a great degree, pharmacists are also knowledgeable about the state of healthcare delivery in the country and how good or bad things are. Now, predicated on that, my question thus: how good or bad is healthcare delivery and accessibility in the country at the moment?
Well, I will just say, in a very summarizing it, is that our healthcare delivery, primary healthcare especially, is at its lowest ebb. The WHO, they are really pushing for universal health coverage in a situation where every citizen will have access to basic health care. But the way we have it now, it is far from what it should be. And when you go to our primary healthcare centers, you have fantastic buildings, but there are no healthcare workers there. Most of them are not well paid. When you go to the pharmacy, it's not stocked. And there was one health center I went to, it's only one nurse that is there in the community, just one nurse, in the whole hospital, one. So that is where we are, people, we are not just there yet. And that is why people die of what they should not die of. Just when you hear of what someone died of, you struggle, to hold back tears.
But Max, there's nowhere, as I said a while ago, where you have a perfect healthcare delivery system. Even in the UK, there are challenges with the NHIS. In the US, you have doctors complaining also. Even in the US, there are, in some states or cities, they are overwhelmed with, okay, well, maybe the COVID-19 situation poses a big challenge to every country, but it's not perfect anywhere, is it?
We don't expect perfection. We work towards excellence. There's a difference between those two. What I'm just saying is that a situation where you cannot have basic, healthcare services in the community is pitiable. And that is what we have in the situation in Nigeria now. And that is why we have a lot of brain drain. Even the healthcare workers are not well paid. They are old and all that. So it's we are yet And the health system is not what it should be. The health system is not what it should be. For instance, when Ebola met us unprepared. And we learned, it was as if we learned our lesson. And then when COVID came, it made us unprepared. And that is, we still go back to square one. You know, so that is just where we are.
When you talked about universal health coverage earlier, what do you mean by that exactly?
I think I tried to explain it in a situation where every person will have access to affordable health care. Affordable. For instance, now, the out-of-pocket expenditure by every average Nigerian, I think I want to say that is the highest in West Africa, sub-Saharan region. It's almost the highest. The insurance scheme is not working. In a situation, we came up with a wonderful idea, but I don't know what is happening to it, where you can walk into a hospital that is registered and then you get treated, and then because of the National Health Insurance, they will take care of that. It's not working, so the out-of-pocket expenditure is very, very high in sub-Saharan, so that when someone gets sick, if you don't have the money in your pocket, you are a goner. You are just gone. That is the problem. And when you go to the hospitals, there are a lot of people that have they've been treated, but because they don't have money to pay for their medical bills, they are still held hostage in the hospital. They cannot go.
Now, beyond, government responsibilities, and no doubt government has huge responsibilities, and in the case of Nigeria, government failings in discharging that responsibility, what can groups? Is there anything that can be done by other persons, groups, individuals, associations to help to mitigate, to at least attempt to bridge the gap as far as this healthcare delivery deficit is concerned?
Well, I happen to belong to an organization. What we do is to support the state, to support the federal government. Counterpart funding, the state brings the counterpart funding, and then of course we also bring part of the percentage. But the situation where what we have, for instance, during the COVID-19, NCDC came up with something, UNICEF came up with something, WHO came in with a lot of money. So all this, we have these support systems. But what I'm saying is that the amount coming from the government is not enough. It can be better than what it is. That is why we have with quality.
Speaking about, you belong to several associations, I imagine. Definitely, I imagine you belong to the Pharmacists Society of Nigeria as well.
Yes, I do.
And I'm guessing that's the one you were referring to earlier on when you were talking about counterpart funding. Or was it a different one?
Well, if we want to talk about, we are all involved, the Pharmaceutical Society of Nigeria. During that pandemic, around April, when it was at this highest level, many organizations, came to the rescue. The PSN also was part of it, and of course, the Christian Pharmacists Fellowship of Nigeria. We had to join hands with the PSN to make sure that some of these basic IPC materials are delivered to where they were needed most at that particular time when it was what was very hot here.
Talking about the Christian Pharmacists Fellowship of Nigeria, you are president. And your association is organizing a free 3 days medical outreach. What exactly is the nature of this, and what is the proposed impact of this free medical outreach?
Excuse me. Well, we want to give back to our community. I think it's when you begin to affect your community, you begin to give back. That is when it is said that you have started to live. It's not just about you, yourself, your family. So this year we are having for the PSN conference in Rivers State. Normally, when the PSN is having, where it is having, we'll be having the conference for that year. The CPFN, which is the spiritual arm of the Christian body, we go there to pray up and do all manner of things. It happened that this year, the Pharmaceutical Society of Nigeria will be having its conference around November this year. So with this, Port Harcourt definitely was chosen. So we have come to give back to our community, true basic healthcare delivery. It encompasses a lot of things, both surgeries. In fact, we have made provisions for cataract surgery and maybe appendectomy. Anyone that comes around, the surgeons are there to take care of them. Unfortunately, we only have 3 days to be able to deliver.
All right, so let's start with the venues. Where exactly are these medical outreaches going to be taking place? And once again, is it nationwide or is it just Port Harcourt, River State?
It's just focal. It's in Omoko Alu. Omoko Alu is just very close to University of Port Harcourt. I think it's in the Ikwere local government area. That is, we started today.
Okay.
We started today.
So it's just there?
It's there. Yeah.
What venue is in precisely?
Is there's a health center there, an outreach, University of UPTH Health Center, the outreach.
Okay.
Yes, center in Alu there, yes.
Okay. So what services are being rendered specifically?
And just like I said, we have surgeries, but for cataract and any other minor surgeries that may arise. We have made provisions for that. And any other medical needs. Those that need glasses, we have glasses to give, and any other whatever medical.
I'm imagining right now that the sheer number of persons who are going to show up for this free medical outreach, how do you hope to contain or manage the number of persons who would want to avail themselves this opportunity?
We did not plan to handle the whole River State. We have
existing government facilities can't handle all of River State.
No, yes. So we're just we had to plan. We had to do some forecasts about concerning the community we've come to serve, and we plan for that population, the target population. It may not be. I envisage a situation where even when we're rounding off, we still have a lot of people that have not been attended to, because we just have only 3 days to do this work.
All right, so who's expected to come? Do you have to be from within Ikwere local government area, or can anyone come from elsewhere, whether within or even, we broadcast even outside River State. So is anyone who is convinced they have a medical challenge invited or expected to be there?
Yes, this is an information age. Anyone who happens to know of what is going on where we are, we definitely benefit from what services that we have. We are not limiting to just Alu community. Even if they come from other states, we will take care of them.
All right. You mentioned surgeries a while ago. You mentioned cataract, and you said other minor surgeries. I don't know what may classify as a minor surgery or what would be a major surgery. So when you say minor surgeries, beyond the cataract that you mentioned, what other surgeries would you be attending to?
Well, I'm not a medical doctor, but for instance, what I may classify as a minor surgery, if someone has an abscess, there's what they call a drainage that will be performed to just make sure that the pus that one is a very, very minor surgery. Okay, but when you now begin to go into the bigger ones, appendectomy is also a minor surgery. But there are ones that we cannot handle at this level.
All right, but the ones you just mentioned, right, they are incursive, am I right? So are they incursive? I think there are surgeries referred to as incursive surgeries.
Yes.
So some of the ones you just mentioned right now are incursive. So I'm suspecting that means there are some incursive surgeries that are minor.
Well, if the ones that are not don't belong to the ones that I've just mentioned minor comes, we'll see how we can take care of them. Unfortunately, the resident doctors they are still on strike because we are partnering also with UPTH. But it just happened that these people just went on strike. So if we have major cases like that, we can refer them to those places.
So how is this resident doctor strike affecting this outreach right now?
Well, these are just volunteers that came with us, that are partnering with us. We have people from Abuja, CBN, Christian Broadcasting Network, you may have known them, Operation Blessing. They also run a program they call the 700 Club. They are partnering with us, so they came with their surgeons and that helps them in their medical outreach. And then, of course, we have other Christian organizations who are partnering with us.
Okay. How about being pharmacists? You're very much concerned with the issue of drugs, medication.
Yes.
What nature of drugs or medication for those whose challenge has been access to medication because of the expensive nature of drugs these days? What nature of drugs are you going to be giving out?
Well, we were able to.
Or what class of drugs to be given out?
All classes of drugs. We, being pharmacists, we had access to the pharmaceutical companies, Emzo, Obeka, Nemeth. You know, we wrote them. They gave us some drugs, so we have quite enough to be able to address the cases that will confront.
All right. So this free medical outreach commenced today.
It started today, yes.
Okay, so I'm suspecting that you were there before coming here?
Yes, I was there.
So can you describe how the event has gone on so far?
What I saw when I went there was very, very interesting. The environment, the canopies, and I saw professionalism. I saw people who were just well seated, and of course the COVID protocol was observed. And then the crowd control, wonderful. And then the crowd flow was just excellent. And they were being attended to. When they see the doctor from there, they go to the lab if it is necessary. And then they go to the pharmacy and get their drugs.
Oh, you have a laboratory there as well?
Yeah, the laboratory.
Running tests real time?
Yes, they are testing on it, yeah.
How about the numbers? What are the numbers like?
I would say that today we had more than maybe around 200.
Doesn't seem like a lot.
I think it is.
Oh, it is?
It is, yeah.
Okay.
And because of this program, I'm believing God will help us tomorrow. Definitely God will help us.
Are you expecting more tomorrow or less?
Because of this program, I am expecting more. Even without this program, this one will really make it big. A lot of people will show up.
All right. If you have any comments or questions regarding the conversation at the moment, let's hear from you. What we are on WhatsApp on 08090306416. Also, facebook.com/Nigeria InfoPH. The lines are open. Feel free to call 0817 923 0002. That's 0817 923 0002 or 0003 or 0007. Are there classes of, some persons may have seen medical practitioners in the past. Their medical conditions may have been diagnosed. The problem could be being able to afford treatment. So for some persons who already know what their conditions are there classes of ailments or conditions that you will not be attending to so they don't bother to come?
We will not say that. We just want others.
Could you hold that thought,
Okay.
please? All right, we'll go for a quick commercial break. We got headlines 5:30 p.m. Discussions continue.
Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162. And let us connect you to your customers. Connect with your customers. Advertise on 92.3 Nigeria Info. Visit our downtown office at Shop 9, Mediatrix of All Gracies Plaza, opposite FIRS, Stadium Road, Port Harcourt, and book your commercials. Call 0817 001 8162. That is 0817 001 8162.
Developments around you only on Nigeria Info. Information is a two-way thing. Nigeria Info, it's your turn. Let's talk.
We connect you to the world. We connect you to the vicinity. We are Nigeria Info.
Listen to me. I said this is a real situation and the government has to do something about it. What are you trying to insinuate? All these people looting Nigeria's money?
This is Nigeria Info, in the heart of Nigeria. 92.3. We are Nigeria Info.
A clean surrounding is a collective effort.
Diseases could be avoided
with good hygiene practice. Be more responsible with how you dispose waste products. The environment will be better looking without litter and exposed garbage. We love our city clean. This message is from 92.3 Nigeria Info.
And now, Hard Facts. Hard Facts with Dio.
Welcome back to Hot Factor 91.3 Nigeria Info and here in Port Harcourt. I'm Dio. Conversation continues. Many thanks for staying tuned, and we're discussing a free 3-day medical outreach and other matters related to the healthcare delivery sector in the country. My guest is pharmacist Max Obeka. He's president of the Christian Pharmacists Fellowship of Nigeria, those who are responsible for this medical outreach. Pharmacist Obeka, you're welcome once again.
Thank you very much.
Join the conversation right now. The lines are open 0817 923 0002 or 0003 or 0007. Comments or questions are welcome. WhatsApp on 0809 030 6416. Also live on facebook.com/Nigeria Info PH. I asked a question before the break. Are there any conditions that you will not be attending to, especially for persons who already know what their conditions are?
Unfortunately, amongst other the cases that we don't have facility for is dental care. We don't have facilities for that for this outreach. So if you have a dental issues, you just go to your dentist. We don't have any instrument installed here.
Okay.
And of course, maybe affective disorders, something like mental cases. We don't have a psychiatrist consulting with us. Mm. So I don't think it will be worth the while. They are coming. Yes.
Okay.
Yes.
Okay, but for most of the issues, you got to attend
exactly.
to
Exactly.
persons, and even if you're unable to provide medical care, you said something about referral a while ago.
Yeah, amongst other things that we are doing there, because it's a Christian organization, we believe that God is working with us. He is the one who sent us, and there are some people who are praying also. We can also give spiritual therapy and take care of those cases.
How critical, how important outreaches of this nature? Is it a third world thing? Does it happen in even other more advanced societies as well, and especially in our society? How important is it that we have outreaches of this nature, and are we having enough of that?
I think this outreach is, I would say, it's more of a third world thing, because there is a gap. The healthcare, just like I said earlier, is what is below what it should be, and so the gap is there to be filled to make sure that people get the basic health care need. In the developed countries, you don't have this kind of thing. There is a functional health insurance in the developed countries. So people coming together to have this kind of program may not really be something.
So maybe I shouldn't waste my time or bother myself going there. How effective really are they? First, in catering to people's medical needs, and two, in bridging this obvious gap you describe?
Well, when people, nothing is really free in the world. When you give something free, people may think that it doesn't have value. I know how much it costs to get a cataract surgery, and the person, the ophthalmologist that is on ground is well experienced. It will cost somebody not less than 150 to 200,000 to be able to get one. Very, very effective. We make sure that we engage someone who is experienced on the job. So it's very effective. All that shows up will be attended to.
I've got a few comments via WhatsApp. Ganu Jimo goes, "Hello, Dio. I just want to commend them for the good job they're about to do." Actually, Ganu, the medical outreach started today, so they've commenced already. Commend them for the good job they're doing, and hope other well-meaning groups or individuals can copy them. Let's talk about that for a bit. How much do we need other groups or associations or even private organizations? How critical is it that they get involved in similar outreaches?
It is very, very important. Many organizations, there are diverse ways they come into the picture. It's not just through health Medicare. Why we are doing this, providing Medicare, because we are healthcare professionals. This is our own area. So other professionals, they have their own way of coming in to give back to the community, to close some of these yawning gaps. So I don't know. Some people, individuals, I was discussing with a colleague of mine, made it a point of duty once in a while to go to the hospital and pay off some bills of people that are still being held because they've not been able to pay their bills. So individuals are doing their bit. It's a lot of activity going out there by Nigerians.
And via WhatsApp, good evening, are they doing COVID-19 RDT for those that may likely present with COVID-19 like symptoms? Because currently COVID-19 third wave is very much with us and a mild descent.
Unfortunately, we did not bring that in. The RDT is not just testing kit, is not just available anywhere to be bought and all that. So it's not really out there to be purchased. So we are not doing RDT tests for COVID.
All right. What other, besides your association is your president and your association is Christian Pharmacists Fellowship of Nigeria. Are there any other associations that you're partnering with to make this happen?
Yes, I mentioned earlier that we had to reach out to our colleagues in the healthcare team. We reached out to the Christian Medical and Dental Association of Nigeria, that's the doctors. We reached out to the laboratory scientists, the Christian body there. We reached out to Fellowship of Christian Nurses. We reached out to them. And of course, the optometrists, we reached out to them. So we reached out to all of our colleagues in the healthcare team. They are there and working.
Now, still in relation to this medical outreach, do you have other programs lined up?
Yes, thank you, Dayo. This medical outreach will dovetail into another annual convention we normally hold, within the fellowship. But this time around, we are kind of having a maiden edition of a joint triennial conference involving the Christian Pharmacists Fellowship of Nigeria and the National Fellowship of Christian Pharmacist Students, the student body. So we are having, it's a thing that we do once in a year. So this is the maiden edition. We're premiering it here in Port Harcourt. So it will commence on the 11th and will run through to Saturday. What informed our bringing the student, we want to get the students closer to us, to know, to mentor them, so that by the time they are leaving school, they already know what they want. They already know the area they want to specialize in. That is what we want to achieve. And of course, it's from the younger ones that will keep the CPFN running. Many of us are already getting old. We are going to hand over to the younger generation. So that is what we envisaged, and we brought this thing in. So we are going to have the maiden edition. It will start on Wednesday. They will start arriving.
And when for that is?
Yeah, we are using Heritage Hotel. Heritage Hotel is at Rumo Logo, I think, NTA Road, yes.
All right, a few quick comments via WhatsApp and questions as we wrap this up. Someone's asking if they have help for diabetes persons and venue. Inema is asking the address as well, and are you doing cataract surgery? TMO, I think, from Adelaide was asking that. A quick response to that: yes, cataract surgery is available. Any help for diabetes patients and the venue once again?
Yes, the venue we have is available, counseling and all that, treatment, drug treatment for diabetes. You get it there. It still is happening at Alu, Omoko, Alu. There's a health center, outreach health center of University of Port Harcourt, a teaching hospital. When you just get to the university gates, when you can take a bike, if you are driving, just take a bike to take you there, where the outreach is happening. From there, they will just drive you, show you the way.
Any final words?
I want to tell you that we thank you for giving us the opportunity to serve this community, because if the River State government had not given us the landing space, we would not have been there. We want to appreciate the River State Ministry of Health, who gave us the access to come here to give what God has given us to share with the people of Omoko. We are looking forward to having you tomorrow. Thank you very much. And to my colleagues, pharmacists, I want to invite you to the Joint Triennial Convention that is commencing on Wednesday. Be there. The arrival is on Wednesday, 11th, and then we're leaving on Saturday with a breakfast outreach. Please make sure you are part and parcel of this. Thank you very much.
Pharmacist Mark Obeka is President, Christian Pharmacists Fellowship of Nigeria. And once again, avails of the opportunity of the three days medical outreach. Pharmacist Obeka, many thanks to you and your colleagues for the great work you're doing.
Thank you very much, Dayo.
Commercial break comes up right now. We've got the major news for the hour at 6 p.m. Open season is up after that. Do please stay with us.